rolling with the changes. COVID-19 isn't the kind of virus that Janet McAllister usually studies. As a medical entomologist, Janet spends most of her time focused on mosquitoes, ticks, and other multi-legged pests that bite and can make people and animals sick. But when the new viral respiratory disease, COVID-19, started spreading across the Midwest, she left her lab and volunteered to fight the outbreak in Wisconsin. She soon found herself bound for Milwaukee, where she expected to put her skills in data analysis and DNA sequencing to work with the CDC team investigating an outbreak of COVID-19 at 2 food processing plants. But after arriving, Janet and the CDC team she joined found themselves shifting to adapt to changing needs and conditions. Janet says, "My experience with deployments is that they're malleable. They're always changing. You need to be flexible and not rigid." While Janet went in expecting to help Milwaukee's health department test samples of viral DNA as part of the outbreak investigation, her role shifted from doing the testing herself to lining up test samples from the state and private laboratories. And while the team was first dispatched to help with outbreaks in plants that made hamburgers and frozen pizzas, more and more outbreaks were popping up in businesses, she says. The CDC's responders end up helping develop checklists that local health authorities can use to help craft public health messages based on community needs, decide when to inspect a workplace, and advise companies on how to protect workers or when to close if necessary. She also helped research systems to track healthcare workers who had volunteered to contain the outbreak. Janet says, "We left them with a nice collection of online tools that they could use for the future." This was a pretty easy and quick process, and it always feels good when we left them with quite a few new tools. It wasn't our main mission, but we were able to do more than we set out to do, and that always makes you feel good. Meanwhile, the deployers faced another problem that had nothing to do with the outbreak. In mid-May, a wave of heavy rainstorms rolled through the upper Midwest. In Milwaukee, the downpour flooded a network of steam tunnels that provided heat and hot water to numerous downtown buildings, including the hotel where McAllister and her team were staying. Janet is no stranger to being deployed. She had been deployed often to hurricane-battered towns that lacked power or water service. In Milwaukee, her hotel room kitchenette allowed her to boil water for use in a bathtub. Janet says, "But it's amazing how much that simple creature comfort means when you don't have it." McAllister normally works at the CDC office in Fort Collins, Colorado. She traces her interest in entomology to her childhood in New Orleans. Her and her sister got a butterfly collecting kit, which Janet says, which I kind of just took over. She says, "I didn't collect butterflies, though. I liked beetles better." She started college with plans to study medicine, but soon found herself more interested in marine biology then discovered medical entomology, which is the study of disease-carrying insects, during a summer job. Janet says, I realized I could marry my interest in the medical field with my interest in insects. She eventually earned a PhD at the University of Arkansas and returned to Louisiana for postdoctoral work at Louisiana State University. There she found a flyer for a fellowship at CDC, studying how mosquitoes that spread malaria build resistance to the insecticides that are used to control them. People aren't the only ones who adapt to new conditions after all. She took what she learned back to New Orleans, where she worked on her hometown's mosquito control program, then joined the CDC full-time in 2004. She was heavily involved in combating the mosquito-borne Zika virus outbreak that struck Latin America and the Caribbean in 2015 and 2016. That experience also taught responders a lesson about flexibility when scientists discovered that the virus was causing birth defects. Janet says, as any situation evolves, our knowledge about it evolves. We think we know a lot about a disease, but nature and biology have a way of keeping us humble, and there's always more to learn.